And now on to updates from the world of business. The US has built the most expensive healthcare apparatus in human history. More healthcare spending should bring more years of life, up to a point. But America has not built the healthiest population. As the global population ages and spending curves steepen, that gap between dollars spent and years gained is defining economic and political fault line of the next 3 decades. The US spends nearly $10,000 per person on health, but life expectancy peaked in 2014. Every other rich nation gets more for less. Japan tops the group near 84 years. Switzerland, Spain, Italy, South Korea all clustered between 82 and 84 years, spending between $3,000 and $6,000 per capita. In America, the life expectancy in 2018 sat at roughly 78.7 years, lower than Japan by more than 5 years, lower than the UK by 2, and critically lower than the US itself was in 2014. After 2014, US health spending kept rising. However, life expectancy stopped rising. The two curves decoupled, and that is not a healthcare system, but a cost engine. The US system runs on private insurance, employer-linked coverage, and administrative overhead that no other peer nation replicates. Administrative costs alone account for roughly a third of total US health spending, a figure that would fund universal coverage in most mid-income countries. Drug prices are unregulated and unilaterally set by manufacturers. Hospitals negotiate rates with hundreds of insurers simultaneously. The billing infrastructure consumes billions annually and delivers no clinical outcome. The money moves, but it just does not move into years of life. This is not a static problem. 1 billion people globally are over 65 today. By 2050, that doubles. Older populations spend approximately 3 times more on healthcare than younger cohorts. More than half live with at least one chronic condition: diabetes, hypertension, cardiovascular disease, conditions that demand continuous, expensive management rather than one-time treatment. The US healthcare market is positioned at the center of this wave. Its spending curve only points in one direction, that's upwards. The question is not whether expenditure rises, but it is who collects the return.